the head is normal cephalic, meaning it's proportional to the rest of the body. It's not too big, it's not too small, correct? Yes?
Yes.
Okay. And then it's at the midline, it's erect. Okay. It's not tilted to one side. Okay. You'll note that the shape of the head is a little oval. Okay. And then we now assess for the consistency of the scalp. Okay. Any tenderness? So the scalp is hard, really hard.
I am very hard-headed.
No, it's so it's hard and smooth. But it's supposed to be hard. Okay. So no bumps or masses that can be palpated. There is no tenderness. So again, you have to do a very thorough assessment of the scalp. It's going to be like very similar to how you would assess the scalp when we did the skin, hair, and nails, except that this time you don't need to look at each section of the scalp. Okay, so that's for the head. Now we go to the face. Okay, so like we said, observe the facial features. You'll know that the different organs are on the same plane, like the eyes, the ears, same plane. Yes.
Yes.
Okay. The nose is at the midline. Okay. You see the eyebrows, the eyelashes. Okay. Now we ask the patient, can you please smile? Okay. Here's the thing. The only reason why I'm standing here is so you can see. Okay. But when you're assessing this, you're supposed to be. How are you going to observe your patient if you're all the way here? Okay. So smile. Symmetrical.
Yes.
Okay. Frown.
She has her lip upside down.
Okay. So raise your eyebrows.
Yes.
Okay. Puff your cheeks. And close your eyes tight. Okay. All symmetrical. So like we said, these facial expressions, this is a test also for the function of cranial nerve 7, the facial nerve, motor component. Okay. So after the face, we now observe the neck. So we note any deviations, any masses, any lesions. Yes, no? Okay, none. So you note that the neck is able to hold, support the head. It's at the midline, no deviation, no masses, okay, no difference. Okay, and then we now assess for the movement. Okay, so first for the trapezius to assess movement of the shoulders. So we ask the patient, can you please shrug the shoulders? Okay, now shrug again, and then resist. Hold it, resist. Okay, so that is the muscle strength. So it's about a grade 3 to 4, which is, you know, the ideal. Okay, here's the thing. When you ask your patient to what they call this, do certain movements, allow them first to do the movement before you assess the muscle strength. You don't go, okay, can you please shrug your shoulders, and then your hands are already down here. So allow them first, because you're now observing the movement. Is the movement symmetrical before you assess muscle strength? So again, shrug. Okay, keep it up. Okay, and then resist. Okay, down. All right, so that's for the trapezius muscle. Now we assess the movement of the head. This is in relation to action or function of the sternocleidomastoid. So chin to chest, please. This is flexion. Resist. Okay. Midline. Okay. And then chin. Look at the ceiling. Hyperextension. Okay. Resist. Okay. So that is hyperextension. Now bring your right ear to your right shoulder. Okay. Resist. Left ear to left shoulder. Resist. This is lateral flexion or lateral bending. And then turn your head to the right. Resist. Turn your head to the left. Resist. So remember, when you assess the muscle strength, it has to be an opposing movement. So when you say chin to chest, you do not Push it down, right? Because it's the same movement. It's the movement downward. So it has to be back to the normal, the original position. Like looking up, can you look at the ceiling? You don't push backwards. You push back towards the midline. Okay. So these are the movements of the sternocleidomastoid. These are for the what they call this parameters for the neck. Okay, then we assess the temporal artery. So like we said, we palpate the temporal artery first. Okay, any pain?
Mm-mm.
Okay, so normally it's not palpable. If it is, like we said, it's supposed to be elastic and non-tender. Okay, after this, then we need to auscultate. So when you auscultate, you use what? Okay, so the bell. Okay, so you use the bell. Just listen. In older patients, you may be able to appreciate a bruit. Okay. Here. All right. Now, after this, we now assess the TMJ. Okay, so we said that the TMJ is just anterior to the tragus. Over here. Anything?
Mm-mm.
Okay, now we ask the patient, can you please open your mouth? So you will note that the movement, the up and the opening of the mouth should give you a 3 to 6 centimeter distance between the upper and lower teeth. Again, please. Is there? A 3 to 6 centimeter distance? Okay. And you continue to palpate and you'll note this, she has very smooth movement of the TMJ. This morning you could hear the click, click, when they move their when they open or move the jaw sideways, you can hear the click or there's the grating motion. Right. So it's smooth, not tender. Okay. And then you ask the patient, can you move your lower jaw to the right? And then to the left.
It's hard.
Okay. So there's going to be movement right, left, about 1 to 2 centimeters. Okay. So this is for the TMJ. Like we said, assess for crepitation, assess for any click. That means there is a problem with the articulation of the TMJ. It might be because of bruxism. Bruxism is teeth grinding, especially when the patient is asleep. Okay, in children, if you, especially in school age children, listen to this. Watch them when they're sleeping. If they're stressed from school, if they're stressed from their parents, you hear them teeth. They grind it. Okay, check your children. Okay.
I'm
So,
stressed from them.
okay, but even adults, if they're stressed, they grind it. You will not know it. You will not realize it until someone tells you. Okay, so what do we do? Then, what they call this? We can recommend a mouth guard. Okay. Otherwise, if you hear this click when you open your mouth, okay, it might not be painful now, but later on this may develop into a full-blown TMJ syndrome, and when you open your mouth, it hurts. Okay. Here's the thing also. That's why when you yawn, you do not just okay, because this one here only allows a certain distance between the upper and lower teeth. So if you open your mouth too widely, sometimes you go okay, it hurts because now you're removing it from its articulation. Okay, and if you keep doing that later on, if you have malocclusion, it will lead to TMJ syndrome, and there's going to be pain here when you open your mouth, even just a tiny bit. It's going to hurt. Okay, so after the TMJ, we look at the trachea. So for the trachea, can you look at the ceiling just a little? Okay. Observe the area here, the midline. Okay. You see any deviation, any masses? Okay. Then we ask the patient, can you please swallow? Did you see the movement? Okay. Easy, coordinated? Yes?
Yeah.
Okay. So that is for the trachea. We're looking for deviation. And then we now need to palpate for the different structures. Okay, so here's the cricoid notch. Okay, cricoid notch. And then here is the thyroid cartilage. A little lower will be the cricoid cartilage. It's the thyroid cartilage, cricoid cartilage. If you were to do an emergency ET, let's say intubation, and you're not in a hospital setting, okay, this is cricothyroid membrane, so this is the space here between the thyroid and the thyroid cartilage and the cricoid cartilage. That's where you make the hole. Okay. Here. Okay, and then down here will be the trachea. Okay. So that will be the structures that you will palpate for. Okay, and then we assess, okay, the thyroid. So when you assess the thyroid in your books, it will tell you two different techniques in doing it. But the best technique is when you stand behind your patient. So this is the a skill that you will need to be behind your patient. Okay, so we ask our patient, can you please turn your head a little to the right? Okay, and then drop it. Okay, so always remember, when you ask your patient to turn to the right, that means you are assessing the right lobe. Remember, the thyroid has two lobes, and it's connected by, what do we call that? The structure that connects both lobes? The isthmus. Thank you. Okay, so this is the trachea. The lobes would go this way, and the isthmus would cut across the trachea. Okay, so when I ask her to turn to the right, I will be assessing for the right lobe. Okay, so what do? It's like you're going to strangle your patient. You do it this way. You're going to strangle her. Okay, so your left fingers feel for the trachea here, and then push towards the right. Okay, with the right fingers, okay, palpate now for the thyroid gland. Am I hurting you? Okay, just a teeny bit of the right lobe. Okay, can you please swallow? Okay, so you feel the movement of the thyroid gland together with the trachea. It rises with the trachea. Okay, now we assess the left lobe. Can you please turn towards your left and then drop it? Okay, this time your right fingers will push the trachea to the left side. This will make the left lobe more prominent. Can you please swallow?
Just swallow.
No, it's hard. It's hard.
Oh.
That's why during the exam I will have a picture of water. Okay, so I can palpate the left lobe. This is a normal finding. You may sometimes be able to palpate the right because it's a little bigger than the left, but more often than not you're not able to palpate it. Okay, but like I said, if you are able to palpate it, you need to assess for the consistency. Is it smooth? Is it firm? Okay, that's the normal finding. Does it rise with the trachea upon swallowing, or does it remain fixed to underlying tissues? Okay, so after the thyroid gland, we now assess the different lymph nodes. Okay, so we start with pre-auricular, okay, post-auricular. Let's turn around so that you can see. Here, post-auricular. Okay. Occipital, along the hairline. Okay, and then you have submental. Unless your patient has a very big face, you just use two fingers to assess the submental lymph nodes. Submandibular, jugular-digastric, anterior cervical, posterior cervical, and you have your supraclavicular. Okay, so those are the chains of lymph nodes of the head and neck. Questions? None? Okay, thank you. Practice, and then at about 12:30 we